Good morning again, colleagues. It is wonderful to be in my shoes this morning for many different reasons. Yes, we are launching our GBV prevention and awareness campaign, which is quite like birthing a child. But I'm equally thrilled to see all of you. It has been a blessing for me to have met with, spoken with, and even initiated partnerships with most of you here today. Welcome and thank you for coming to share this moment with us. PSI-Caribbean has spent the last year reaching out to organizations and agencies involved in gender-based violence, including intimate partner violence and domestic violence. Through this reaching out, myself and our regional program manager, Moira Lindsay, we've had an incredible opportunity to meet most of you in this room. And we've also learned about your organizations and how the work you do fit into the GBV landscape. I could talk about the problems and the challenges that GBV poses to our society, but I won't. I choose to use my time to talk about what we've seen and heard over the last year that has contributed to us being here today. Our purpose for engaging with your organization, if you would recall, was threefold. We were interested in finding out where the gaps in GBV prevention existed and seeing how best PSI-Caribbean could fill those gaps. We also realized that as is the case with most social programming, the resources to do the work are limited. We were eager to learn about the work that you do to see if there were areas in which we could lend support technically or financially. We also wanted to share with you our strengths, which are our abilities to reach vulnerable communities. That, and as well as our evidence-based programming, we are also highly proficient in behavioral change communication. We have some of our educators in the audience. As I will keep saying, the learning was incredible and the personalities more so. You know yourselves. The drive, the passion, the ingenuity which you apply to get the work done is mind-blowing and a lesson in resilience and strength. I thought that maybe I would not attempt to recognize the organizations we met for fear that I would miss one. But it's part of my storytelling, and I know you will either forgive me or buff me after. While a situational analysis was undertaken that provided a background from which our program objectives were developed, words on paper were just the beginning. We needed to hear from you. The urgency and the importance that we need to infuse in our work, particularly the National GBV Prevention and Awareness Campaign, came from hearing about issues from your organizational perspectives. The body of information and the work that you do is amazing. It's just simply amazing. Thanks to Falade and Winard for the historical perspective. Thanks to Childline's Mary Moonan, who's here today, Toko Foundation, and Nesta Flanders Skeet for coming in and sharing the work that you're doing. Of course, we all know Hazel Brown's network of NGOs for their continued outreach to women and children, Elizabeth, fondly known as Betty Spence, and the incredible Families in Action team, who we are honored to collaborate with in providing support services to survivors of intimate partner violence and domestic violence. Thanks to those organizations that sent participants to our Train the Trainer workshop in December, led by Andrani. I am sure my colleagues from FPAT, The Shelter, Families in Action, CADV, that's the Coalition Against Domestic Violence, and Friends for Life would echo that the experience changed us. I want to acknowledge Rape Crisis's Lydia Walcott, who on short notice 2 weeks ago was able to invite women to attend our focus group around this said campaign. We also had a productive meeting with the Ministry of Gender, Youth and Child Development. They have expressed interest in collaborating with us as we sought to engage communities and youth. Thank you, Monica Williams. I also feel compelled to mention those organizations whose direct mandate is not GBV, intimate partner violence, or domestic violence, but due to their intimate interactions with women, they are well positioned. Mama Toto, your work in sensitizing midwives around this issue is to be applauded, and we welcome the opportunity to partner with you in this initiative. Thank you. Nicole Chin, the services that BraFit provides for vulnerable women. I'm looking for Nicole's fan. There it is. The services that BraFit provides for vulnerable women is one that offers interesting opportunities for collaboration with GBV service providers. As I mentioned before, I could, but if I did seek to recount all that we heard and learned from the organizations that we engaged with over the last years, you'd have to kick off your shoes, get real comfortable, and hang out for the rest of the day. I would love that, but I don't know. I know you probably have to get back to the office. As I give way to the reveal of our brand, I have to mention those persons closer to home who make the work possible. Not just the PSI in-house team who are here today and you will meet before you leave, but the others, like our research consultants, Cure, who have recently completed a national survey on IPV of those of close to 800 households, as well as focus groups with young people and in-depth interviews with survivors. We look forward to sharing the results with you soon. That should be in another couple months or so. And then there's our technical advisory group, who is lending support in a number of programmatic areas, particularly the development and rollout of our youth empowerment program, which will be coming to a community or institution near you in the next coming months. Tracy Rogers, Jackie Burgess, Alex Vega, Reverend Shellyan Tenair, Lisa Sargent, and Christoph Granger, thank you. That's our technical advisory group. Ultimately, the work we do is for our youth, our children, and our next generation. PSIC is seeking to stand in the gap through our youth empowerment work and this National Gender-Based Violence Prevention and Awareness campaign. Thanks to the young people who attend our focus groups, participate in our roundtable discussions, check out our Facebook and other social media sites. Keep the feedback coming and join us in the movement to end gender-based violence in Trinidad and Tobago. It can be done by changing the hearts and minds and providing both men and women with the tools and skills to do it differently. So that's the prepared speech. Now we're going to get a little funky. So our big reveal, which is coming, was to take place on this screen. We're getting a little problems with the glare. But if you know PIC, we are innovative. We take everything in stride. So what we have done is that and they've taken away my mic. They have literally set up monitors across the room where you can actually see the release, which could lead to a little bit of networking. You could talk instead of sitting down. You could grab a drink. We play it over and over and over again. So I'm going to say my last line. It is my pleasure to present PIC's offering in the PSI-Caribbean's offering. What am I saying? Oh, you know what that is? That's probably a slight form of dyslexia. Or, you see, or maybe the fact that I have not slept in the last 3 nights. Bear with me. Sorry. Population Services International Caribbean's offering in the fight against gender-based violence in Trinidad. Thank you. We ask you to take a look and get up and walk around, and the reveal will happen on the screens.